waiting a while to talk about these gynae pelvic emergencies.
We really, really have. And it's such an important topic. And what's amazing is I get to pick your brains and you get to pick mine today. Me from an emergency perspective and you from the gynae perspective.
So let's talk about a 30-year-old girl who comes to the emergency room with abdominal pain. How would you approach that, Tanzila?
Yeah. So, I mean, as soon as I have a young woman, I think about all the gynae things. But the first things that we look at from the emergency perspective is, what are the vital signs? And that basically means I'm looking at their oxygen, I'm looking at their blood pressure and pulse. And people might not think of why that's important, but as you know, there are very life-threatening conditions where you can be losing a lot of blood or your pressure will go down, whether it's an infection or not. So that's my first step, making sure is the patient stable and well, or is this a life-threatening thing and I have to run to it. So once that is kind of differentiated, I have to then think about, what is going on. So our history. So I'll leave the gynae stuff for you and just talk about the other things that I asked. So I'm asking, is there fever? Is there any new contacts that they've been around? Are they vomiting? Is there diarrhea? Where in the abdomen is there pain? Is it upper? Is it lower? And all the things that we think about. So it involves getting a really good history, pregnancy history, and just as you know, everyone is pregnant until proven otherwise if they're a young woman coming in. And so finding out a really good history as to what is happening is important. And then moving on to a physical exam and further investigations. But what are some of the things that you think about when someone comes in?
Yes, so from our perspective, like you rightly said, what are those life-threatening things? Ectopic would be the first thing.
Yeah.
So when I come in there, I ask you, Tanzila,
biggest
is
fears?
she pregnant or not? And you tell me she's not. Then I take a pause and I'm thinking about other things. Things like ovarian accidents in a younger woman, like something called torsion, bleeding into the ovary, or even having a ruptured ovary. I'm looking at this from the heart of a gynecologist. Having said that, I think of appendicitis as well.
Yeah, for sure.
So when you call me, even though your history is thorough, I want to know how sudden is that history, and is there any nausea and vomiting, because that tells me about ovarian accident, which I think is important because of the consequences of torsion if we miss that.
And for our viewers, so when we say ectopic pregnancy, it means that the pregnancy is outside of the uterus. It's either in the ovaries, right? And sometimes it's in the abdomen. And that means that it could rupture. And that is life-threatening. And that's like the thing that keeps me up every night. Is gynae in a house if that happens? It's a big one. And torsion, when you say, for our viewers, it just means twisting of the ovaries. And there's various factors that play into it. So for sure. In terms of non-gynae stuff, things that I also think about outside of appendicitis are, kidney stones. They can mimic a lot of these pains because it's back pain that goes into the front, into the groin. Infections, so especially sexually transmitted infections that cause something known as pelvic inflammatory disease. So that's where swabs and all those other things come in, and that history. Sometimes those go to you guys because you often have to, admit them and treat them. What are other things? I'm trying to think. I guess for older women, we think of other things like diverticulitis, which is a gut infection, and constipation and all these autoimmune things. But as soon as I hear a young woman, you're in the back of my radar. Do I need to call Dr. Tunde-Byass?
I'm glad you mentioned constipation because it's a mimicker of everything.
It really is.
So when we come there, then we do our examination. Does the abdomen, does it feel tense, tender? Then I have to do a speculum exam, take the swabs, and also check the ovaries, check the uterus. Is this so painful? Then, of course, if you have not ordered the imaging, which I'm sure you have, usually the ultrasound, because once the pregnancy test is negative, my focus is on ovarian accidents. So
what are some of these accidents that you're referring to?
So we talk about torsion.
Yeah.
It's the ovary twist on itself, or you bleed into your ovary, or it ruptures.
what puts somebody at a higher risk of it twisting? Like, is it a
Well, if
lifestyle
you-
thing or genetic?
Probably not. Some people have like an underlying ovarian cyst, which they don't know about. And also, in some people, they could have something that they were born with, whereby, the adnexa, which is the side of the uterus, is a little bit longer than usual.
Okay.
But this is something that you don't even
wouldn't
know
know.
about. So, coming to the emergency room with severe vomiting in a young woman who has been previously well, you need to think about ovarian accidents.
And the other thing, I've had a case where the ultrasound was normal, and what happens is the uterus can twist and untwist, and then twist again. So, again, that history and exam and your expertise is so important, because sometimes that will dictate, do we still have to go in and make sure that there's nothing going on?
So you're right, because sometimes I might get there and the pain is gone.
Yeah.
It's either of two things. Either it's untwisted or the ovary is dead.
Too bad, yeah.
So important that when you order the ultrasound, ask for Dopplers, which is the blood flow. Is there a blood flow into that ovary? Having said that, the blood flow might be there, but they still have torsion. So it's important to do that. And rarely, if we're still confused, CT, MRI is something that you can still order in the emergency room.
That's great. And so for our viewers, it's really important, if you've had an ovarian cyst that you know of, it's important to tell us that, because then we're thinking of these different things. Not saying that this happens to everybody for sure, but it's just important information for us to know. Okay, so the person comes in, we've ruled in or out pregnancy, we've done our ultrasound, I maybe have called you. So let's say they have one of these emergencies and they're going to the operation theater or something. What kind of preparation, is needed? What do they need to know about?
So I need to be clear. If it's not ectopic pregnancy, and we keep talking about, say, it's ovarian cyst that has twisted and is torsion, that to me, it's an emergency.
Right.
It's almost like having a testicular torsion. The difference is that with a testicular torsion, you can actually
outside,
see it.
yeah.
But ovarian,
It's
you
hidden.
can't. So time is of the essence. I need to call the operating room and say, I need that room. I need to have a laparoscopy booked, and I need it now.
And what is a laparoscopy for
So
our viewers?
laparoscopy, for our viewers, it's just a procedure that we do. We go through the belly button and put in a camera, which gives us a better visualization of the uterus, the tubes, and the ovaries, and actually the back and the front of the uterus. So it's very cool. And that
Like
is
a direct looking
it's
right
a
in.
direct
Yeah.
look. You can see it eye to eye. You're not guessing. And this is even beyond.
And it's
an
tiny
ultrasound.
little slits,
Oh,
right?
it's a-
Very tiny.
It's a very
not
tiny
major-
hole.
Yeah.
It's a very tiny hole in the belly button, and also maybe 2 holes at the sides. Very precise. We go in, we take a look. If it's a cyst that has ruptured and we didn't know about, we don't need to do anything.
Right.
If a cyst that has bled and there's blood in the abdomen, we need to remove
it
all
up,
that blood
yeah.
and clean it up. And if the ovary is not bleeding, that's the end of my work. But if it's torsion, which means I have to untwist the ovary and leave it alone.
Right. To let the blood flow get back
Let
and
the blood
heal
flow
again.
back. We avoid removing the ovary, especially in a young
For sure.
reproductive age woman. If it's someone who is much older, they've completed their family, then there's,
Sometimes
a
you
chance
might want
to
to
remove
get rid.
it.
Yeah.
Otherwise, you want to leave it and preserve the reproductive function so that ovary can actually work.
Yeah.
And we've
It's
seen
fascinating.
that. Oh, very fascinating.
Time is tissue, they say, right?
Time is tissue. It's just like the heart. It's important. And in 3 months, when you come back, we repeat the ultrasound, and the ovary is back to normal again.
Amazing.
Indeed.
Another topic that I do want to talk about is pelvic inflammatory disease.
Right.
So oftentimes, we think about STDs and we think about gonorrhea, chlamydia, and all these other infections that, you do a swab, you take your antibiotic, that's it. But a lot of times these get missed, and then the infection tracks up into the uterus and the surrounding areas. And that's why it's so important to always do your STD screening and get tested, even if you don't have symptoms, because it can flow up and cause permanent damage. And so what are some of the things that you guys do? So let's say I have someone with pelvic inflammatory disease. I know my protocol is start them on antibiotics and then talk to you guys. What do you do after that?
So what we want you to understand is that pelvic inflammatory disease has to be treated because of the consequences, which is infertility, the tube becomes damaged, ectopic pregnancy, not being able to have children, and also chronic pelvic pain.
Yeah, that's a big one.
Antibiotics and making sure there's compliance.
Yes, taking them.
You have to take the antibiotics. You have to complete it. You have to make sure you're better and then go back for a follow-up if you're not. So pelvic inflammatory disease can be treated and you can prevent all those consequences in the future.
Yeah. No, so I think those are the big ones that I think about. Other non-big ones, I guess let's talk about non-life threatening. So if someone's coming in and they have, a mimicker of appendicitis, we often call, is Mittelschmerz. So it's like essentially an ovulatory pain. So when your egg is released, you have a little bit of fluid that gets released as well, and that causes quite a bit of irritation in the abdomen. And then what are other non-life threatening, I guess some of the infections we mentioned?
Yeah, we've talked about Mittelschmerz. Sometimes people have fibroids.
Oh, right.
And the fibroids might have like a smaller fibroid on top of it with a stalk, and it gets twisted as well.
Right.
And that causes a lot of pain. So fibroid is there, and always kidney stones.
Oh,
I
right.
never
Kidney
forget
stones.
that, because kidney stones, honestly, it's almost like having labor pain. So you must remember to do the urine test, check for blood in the urine, and also use imaging, right?
Yeah. And infections and all that.
That's right.
This is the thing. That's the beauty of the hospitals, that we work together and we're kind of solving these issues. And if it's appendicitis, then we send them to the general surgeon, who have their own protocol. Sometimes it can be a bowel obstruction. It can be a lot of other causes. But for the most part, for a young, otherwise healthy woman, these are the big ones we think about. And a lot of them are things that, we want our viewers to think about. Are you having excessive bleeding? You're feeling dizzy, lightheaded. You could be pregnant that you didn't know, and it was ruptured. Are you having pain with vomiting, like you were mentioning? Could it be twisting of the ovaries? Could it be a lot of other things? So don't ignore pain. At least speak to a healthcare professional. What are some of the things that you would say? What should they try at home before going to the emergency department?
Well, I think the bottom line is knowing your body. If something's not right, it's probably there's something wrong. You come, you've watched the pain, it's getting worse, you have bleeding, you have vomiting, you have fever. You've got to, if you can't get hold of your family doctor, you can see your own gynecologist. You still need to come to emergency room. And I think it's important for our viewers to understand that this pain could be life-threatening or non-life-threatening. You may not be able to distinguish which one it is.
And that's why we're here.
And that's why we're here.
So yeah, that's it. I think, it's something we want to talk about for a while, and I'm hoping that this helps everybody. And hopefully we can cover more topics like this in the future. So don't forget to give us feedback, leave comments, and let us know what you think.
And please reach out to us at WHEMS. We're on Twitter, Facebook, Instagram, and LinkedIn. Thank you so much, our viewers.
Bye.